Probiotics. Does everybody need them? The World Health Organization defines probiotics as live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. In order to be labeled a probiotic, scientific evidence for the health benefit would have to be documented. Now that we know what a probiotic is, let's dive into whether or not you should be using them on a daily basis coming up next. There are thousands of different kinds of bacteria, and there are many different kinds of probiotic bacteria, with some of the most common probiotic bacteria being Lactobacillus and Bifidobacterium species. And even some yeast are considered probiotic. Why these bacteria and yeast are helpful is that they are similar to the bacteria and yeast that naturally live in our healthy gut. But also remember that in order for these good bacteria to make it a positive benefit on your health, they must make it past the acidic environment of your stomach and into your gut, and not all forms of live bacteria have the ability to do that. The term probiotic is currently regarded as a health claim. This means that if you see the term probiotic on a label, it must abide by the World Health Organization definition of a probiotic by having the ability to get past your stomach, into your gut, and once there, they must have a positive impact on your health. Many times on food and supplement labels now, you'll see the term live bacteria as opposed to the term probiotic. And I just wanted to make sure that everyone knows that probiotics contain live bacteria and sometimes yeast, but not all live bacteria can be considered a probiotic. This, however, does not mean that without the term probiotic on the label, it's not a good supplement or a good food. Now that we have a full understanding of the term probiotic and live bacteria and what that means in regards to your health, let's look into the top 4 reasons that you absolutely should be taking probiotics every day. Number 1, antibiotic-associated diarrhea. There is good evidence that taking high doses of probiotics such as Lactobacillus and Saccharomyces can greatly reduce the risk of getting antibiotic-associated diarrhea, especially when taken along with your antibiotic treatment. Probiotics, along with antibiotics, can also decrease the risk of getting a dangerous gut parasite called C. diff that is associated with antibiotics killing off all your good gut flora, letting the dangerous pathogen take over and wreak absolute havoc. The probiotics in this case help to maintain a stable and healthy gut flora, even when your gut flora is under attack by the antibiotics that you may be taking for an unrelated reason. Number 2, acute and infectious diarrhea. This is a condition where your gut has either a bacterial or viral infection causing GI discomfort and diarrhea. Acute infectious diarrhea is very common, especially with infants and small children, and it's been shown that during bouts of infectious diarrhea, taking a good probiotic can minimize the time that your little ones or you suffer with infectious diarrhea. Number 3, irritable bowel syndrome. Irritable bowel syndrome is a chronic disease characterized by abdominal pain and discomfort, as well as bloating, gas, constipation, and diarrhea. It affects 7 to 21% of people around the world, and they're 3 times more prevalent in women as opposed to men, especially in the West. Changes in the gut flora may influence IBS symptoms by increasing inflammation, increasing sensitivity to gas in the intestines, reducing immune function, and changing digestive motility. IBS symptoms have been linked to certain changes in the gut flora. For example, people with IBS have a lower amount of Lactobacillus and Bifidobacterium in their guts, and the higher levels of harmless Streptococcus, E. coli, and C. diff. So taking a probiotic that is high in both Lactobacillus and Bifidobacterium may decrease many of the uncomfortable symptoms associated with IBS. Number 4, lactose intolerance. Lactose intolerance is defined as a digestive disorder caused by the inability to digest lactose, the main carbohydrate in dairy products. It can cause various symptoms including bloating, diarrhea, and abdominal cramps. People with lactose intolerance don't make enough of the enzyme lactase. which is needed to digest lactose. However, some studies have shown that lactobacillus may decrease all of the symptoms associated with lactose intolerance. The bottom line, probiotics are thought to help restore the balance between good and bad bacteria in your gut when it has been disrupted by illness or medical treatment. So if you're healthy, not on antibiotics, and not going to the hospital or about to travel abroad, you probably don't need to take probiotics on a daily basis, unless instructed by your healthcare provider for a few other rare cases. So save your hard-earned money on your daily probiotic until you have a suspected GI disturbance or you're about to encounter something that could cause a GI disturbance like antibiotic usage or travel. Thank you for stopping past the channel. If you enjoyed this video, give it a thumbs up. And if you'd like to see more content like this, please hit the subscribe button and you'll see it as soon as it comes out. Thank you, and as always, have a beautiful day.